Complications following ovariohysterectomy. Well, really, there's several potential complications. The most common would be hemorrhage. When treating hemorrhage, or one could accidentally ligate the ureter, so urinary tract obstruction is a complication, but that is less common. A draining fistula, or draining tract, usually from non-absorbable braided suture material. And then the final common complication or major complication is persistent estrus, when the ovary was incompletely excised. So the timing of complications can be intraoperative. That is what is most commonly seen with hemorrhage. It's at the time of surgery. The abdomen starts welling up with blood, and then the surgeon needs to address it at that time. Hemorrhage can also occur within the following 6 to 12 hours, where the patient maybe goes home with the owners. The owners notice that the dog or cat is depressed, listless, won't eat, won't get up and go outside, maybe has abdominal distension, and that's usually from hemorrhage. And delayed hemorrhage like that occurs usually because the suture is a bit loose and fell off, or incompletely occluded, so the hemorrhage was just a bit slower than a large volume of hemorrhage that would occur intraoperatively. The other complications can occur months to years later when you find them. For example, a draining tract might occur several years after the spay was taken place, and the suture material, non-absorbable, braided, got contaminated either at the time of surgery or because there was a bacteremic event. Then the patient has a bit of immune suppression, and that contaminated suture then becomes an infection, and then develops into a draining tract. Something like persistent estrus, again, probably months after it would be, when the dog went into heat the next time, so you wouldn't notice it immediately after surgery. And then I would say the final complication of obstruction of a ureter, we rarely notice it. We probably only see 1 or 2 cases a year are referred to us where we see that complication. Probably occurs more often than that, just because a dog or cat can have a single ureter obstructed and sometimes no clinical signs develop, or maybe they develop later on in life. And when renal disease is being explored as a problem, that's when it's identified that it's completely obstructed.